Welcome to the module on water and health. More than 75% of Earth is water. Similarly, nearly 75% of the body composition is water. It is not a magic bullet, but the benefits of water are many. By means of water, we give life to everything. This is in a nutshell explains the importance of water. Water, as we all know, it is H2O. It has two molecules of hydrogen and one molecule of oxygen. It is an essential element for the survival next to air. Revitalizing property is the well-known property of water. Water is very vital to human body. Without water, the body cannot function. Each and every cell and organ in our body is made up of water, and it needs water to function. It serves as a lubricant and forms base for the saliva. After going through this module, you will be able to explain the importance of water for health and maintenance, the hydration status in human body, the effects of dehydration on health. Human body contains 70 to 90% of water. The proportion of water in human body differs according to age, gender and body composition. Water makes up more than 2/3 of the weight of human body. In infants and children, the percentage of water will be more when compared to adults. The main function of water is it acts like a building material and regulates the internal body temperature. Without water, the human cannot live for more than 3 to 5 days. This shows the importance of water. The body water percentage during the different period of life is shown here. Water is found throughout the body, even in body cells, tissues and organs. The distribution of water in human organs is shown here. Water is distributed in three compartments like intracellular water, extracellular water and interstitial water. Now let's see what is intracellular, extracellular and interstitial water. Intracellular water is the water which is present inside the cell. 2/3 of the body water is intracellular water. The remaining 1/3 of the water is extracellular water, which is nothing but lymph, plasma secretions and spinal fluid. The water which is present between and around the cells is called the intercellular water. That is, it is also called as interstitial water. The interstitial water always flows to the plasma through the capillaries and held in a gel in the intercellular spaces. Abnormal accumulation of fluid in the intercellular spaces is called edema. Now let's take a look at how the body regulates the water requirement, that is water balance. In other words, it is called as water balance. Adverse consequences occur when there is shift in water balance. To maintain the proper balance, the homeostatic regulations are done by gastrointestinal tract, kidneys and brain. The amount of water taken in approximately equivalent to amount of water loss. Let's take a look at the water requirements of human being during the normal functioning, in extreme weather or during the vigorous workout. Water intake is controlled primarily by thirst in healthy individuals. Thirst is stimulated by the cellular dehydration and decreased extracellular fluid volume. Water is ingested as fluid and part of some foods. When the food gets oxidized in the body, the metabolic water is formed. The oxidation of 100 grams of carbohydrate, protein and fat yields 107, 55 and 41 grams of water respectively, and as a total it makes nearly 200 to 300 milliliter of water per day approximately. Okay, now we would take a look at the various functions performed by the water in our body. The water performs enormous functions. Let us see one by one. Regulatory mechanism. The fluid intake and excretion is very important in regulating the water balance. There exists the balance between the fluid intake and excretion, which is called the water balance. The water is excreted predominantly through kidneys in the form of urine, through skin in the form of sweat, in the form of water vapor through lungs, and little through the intestine. If water balance is disturbed, it affects the body functions, like it may increase the blood pressure, blood sugar, or disorders in the brain function. Transport medium. Water is the only source to transport nutrients to the cells. It helps to transport the waste from the body to be excreted. Detoxification. Harmful metabolites of the body are washed away by the water, and the process of detoxification is done efficiently. Water as solvent. Water is a good source of solvent. It helps to dissolve the nutrients to be transported across the body and helps in its absorption. Thermal regulation. Water plays a very important role in relation to body temperature. It regulates the body temperature by the means of sweating. Electrolyte balance. The balance of vital electrolytes in the body is called electrolyte balance. The electrolytes are potassium, sodium, chloride, phosphorus, magnesium, and sulfur. Inorganic minerals present in the tap water or mineral water is not utilized by the body when compared to the organic minerals which are found in fruits, vegetables, meat, and cereals. The underutilized minerals have to be excreted from the body through the kidney with the help of water. Water also revitalizes, that is, re-energizes the body apart from other functions. It provides some nutrients and minerals essential to human body. It is the main component of human body, containing at least 50 to 60% of total body weight. The proportion of water depends upon age, sex, and body fat content, as we discussed earlier. There is no carbohydrate, fat, or protein in water, hence it doesn't provide any calories. For nutritionally balanced diet, water is very important. Even though there is no visible sweat loss, nearly half of the water lost through skin and lungs as water vapor. It is good to drink half a liter of water in each and every meal. Water is one among the 6 basic nutrients. It is very important to humans since all the chemical reactions that takes place in the body, it happens in the presence of water. For example, energy production, even for the metabolism of other nutrients we need water. It helps to flush out the waste metabolites from the body. It promotes the health of gums and teeth. You may ask, what is the benefit of water around and inside of us? Now, let's take a look at the benefits of water. There are ample number of evidences suggesting that goodness of hydration. As far as now, there is no proper estimate of water requirement for the individual. Some studies suggest that the water requirement per day for men is 1.2 liters to 3 liters, whereas for women it is 2.2 liters. This is roughly represented that 81% of our total body or water requirement, whereas 19% of water sources come from food which we take. The benefits of good hydration, there are so many. It relieves and prevents headache. Headache is the first symptom of dehydration along with dizziness and lightheadedness. Headaches are the result of mild dehydration and it can be relieved within half an hour by drinking water of 200 ml to 1.5 liters. To reduce the frequent occurrence of headache or migraine, one has to consume extra water daily. Proper hydration assists in good blood supply to the brain, thereby preventing the occurrence of headache. Concentration and mental performance. Consumption of water is important for the mental performance too. Hydration, that is dehydration, which is the mild to moderate category, has shown to affect the performance by increasing the feeling of tiredness and reduced alertness. If the thirst is not quenched, the performance is decreased by 10 to 15%. The functions affected due to dehydration are lack of concentration, lack of memory, attention and reaction time. If this condition is not treated, the performance of an individual is deteriorated further. Due to dehydration, the hand and eye coordination, that is eye-hand coordination, is affected. The immediate revitalizing effect can be achieved by consuming lot of water. Water also takes on a new avatar in fighting against the deadly diseases. Let us look at some of the diseases that right intake of water can avoid, or it helps to minimize that. Prevention of certain type of cancers and chronic diseases. Maintaining good hydration status helps to prevent the individual from various chronic diseases and certain type of cancers, especially colon cancer. The following conditions can be prevented by good hydration status: breast and colorectal cancer, coronary heart diseases, stroke, thrombosis, cholelithiasis, urolithiasis and nephrolithiasis. Preventing urinary tract infection, this is otherwise called as UTI commonly. For healthy kidney and urinary tract, water is very important. The kidneys make urine to remove the water soluble waste products from the body. It is known that adults normally excrete around 1.5 to 2 liters of urine per day. Kidneys play a vital role in maintaining the water and electrolyte balance in the body. The diluted urine indicates that excess of solutes are being excreted from the body, where the concentrated urine prevents the escape of solutes from the body and helps to prevent dehydration. Compared to men, women have higher prevalence of UTI. The infection is more common in lower urinary tract composed of urethra and bladder. If it is not treated in the initial stage, the infection may spread to the kidneys, leading to kidney stone formation and urinary tract obstruction. That may lead to some kind of renal problem, or it may end in renal failure. When the frequency of urination is reduced, the risk of urinary tract infection is higher. Less output of urine, it is also one of the reasons for urinary tract infection. The best way to avoid or prevent UTI is by maintaining the good hydration status. A minimum of 2 liters of water should be consumed per day, and the urine should be passed frequently. The urinary bladder should be empty to prevent from bacterial infections. Water plays a key role in the digestive function of the body. Even it relieves from constipation. The foremost reason behind chronic constipation is inadequate fluid intake. Persons suffering from constipation, if they take adequate liquid, the frequency of stool can be increased, and it can further enhanced by dietary fiber intake, that is consuming lot of cereals, greens, vegetables and fruits. Drinking adequate fluid improves the stool consistency, and it relieves from diverticulitis and hemorrhoids. Too much or too little water can cause health problems. Water helps for the body weight maintenance. You may be surprised. Water is also very important for weight loss regime. The logic behind water in weight loss process is that water, when it is consumed before the meal, the food consumption can be reduced, which ultimately reduce the calorie intake. It also helps to decrease the appetite. The sign of dehydration Also includes burning sensation of the stomach ache, and the feeling of emptying of the stomach, which imitates the hunger. Instead of consuming soft drinks, which are rich in empty calories, that is the carbonated beverages, it has been found that drinking water increases the metabolic rate by 30%. Some evidence also suggests that increased hydration helps to break down fat. Now let's take a look at the importance of water for physical performance. The capacity of physical work can be reduced 1/4 with a mild dehydration of around 1 to 2%. The drop in physical activity is more severe in hot environment as the level of dehydration increases. Until the moderate dehydration, the muscle strength is unaffected. But once the muscle strength starts affecting, they suffer mainly from upper body muscle problems compared to lower body muscles. The water loss during exercise mostly depends on the level of sweating through the skin and the loss of water as water vapor, which is exhaled in the air. High endurance activity and hot environment tends for more body water loss, and there is high chance for getting dehydrated, and also it declines the physical performance. It is important to be well hydrated before and after any type of physical activity or exercise to replace the body water loss, and during exercise at the frequency of 10 to 15 minutes water should be consumed. For continuous exercise up to 1 hour, water is adequate for fluid replacement with adequate salt from the balanced diet. Even swimmers should maintain their good hydration level because immersion in the water makes less sensitive to thirst. So they should be very careful. Maintaining good oral health. Dry mouth is also a sign of poor hydration. For proper synthesis of saliva, water should be adequate, and less saliva secretion is bad for oral health, and saliva contains an enzyme which is essential for the digestion of many nutrients. So if water is not adequately taken, that affects the digestion and absorption of many nutrients. The functions of saliva in maintaining good oral health are as follows. The acid created by the tooth decay creating bacteria are neutralized by the saliva. Oral membrane lubrication, presence of mineral that enables tooth repair. It contains an antibacterial agents that inhibit the growth of oral bacteria against gum diseases. Fluids such as fruit juices, soft drinks, carbonated drinks contain sugar which cause damage to the tooth and enamel. So it is advised not to consume more of carbonated beverages or other kind of sugar containing juice. Healthy pregnancy. The water requirement during pregnancy is higher due to the need of the growing fetus and the amniotic fluid. Inadequate fluid intakes can lead to decreased amniotic fluid surrounding the fetus. If there is less fluid, that is amniotic fluid, the growing fetus cannot receive appropriate nutrition and the oxygen for its growth, so its development is hindered. And also it creates the difficult situation for the baby to turn head down before birth. Drinking water is an effective way to restore the amniotic fluid, and hence the water intake should be adequate during pregnancy. It prevents gallstones and kidney diseases or the kidney stones. Good hydration prevents the crystallization of mineral salts in the kidney. Similarly, excess water intake helps in dilution of bile and thereby stimulates the gallbladder to empty its content, preventing the formation of gallstones. Consumption of water prevents cardiovascular disease too. Adequate water intake reduces the risk of cardiovascular disease by nearly 50%. It prevents from formation of blood clots by reducing the blood viscosity. Consumption of water prevents hypotension, dizziness due to hypovolemia. Hope you know what is hypovolemia. It is decreased blood volume or blood plasma. This leads to hypotension. Drinking adequate fluids helps to maintain good blood volume that can be supplied to the brain, and it prevents hypotension, that is decreased blood pressure. It helps for the healthy skin. Good hydration paves the way for the healthy skin and young looking. This skin acts as a water reservoir and helps in the maintenance of entire fluid balance in the body. Mild dehydration can cause the skin to look loose and dry, flushed, and loss of elasticity, which makes to look very older. The effects of dehydration can be noticed more on face when compared to lower limbs. Water also helps to fight infection by eliminating the disease-causing toxins and microbes out of the body, and it prevents from the urinary tract infection and kidney stones. Assessment of hydration. Human hydration assessment plays a pivotal role in the prevention and treatment of electrolyte imbalance. When there is dehydration, there is maximum frequency to fall sick. Fluid deficit can lead to improper homeostasis, performance, and makes a person unhealthy. Hyponatremia, that is decreased potassium levels in the body, it is a serious clinical complication due to poor hydration. Body fluid regulation can be determined using blood, urine, which will be serving as a chief measure of hydration. Physical signs and symptoms like headache, dizziness, tachycardia, sunken eyes, and unhealthy skin indicates the severe dehydration. The simple markers of hydration status are body mass, thirst, and urine. In athletes, for measurement of hydration changes, body mass is used often either in lab settings or in environment. Changes in acute hydration are calculated as the difference between pre and post exercise body mass. The level of dehydration is the best expressed as a percentage of starting body mass rather than the percentage of total body weight, since the latter ranges widely. Thirst is a reliable subjective feeling reported by a person in response to fluid restriction. The average plasma osmolality at which the thirst is stimulated above baseline, it is approximately 295 millimole per kilograms. In most circumstances, the use of first morning body mass combined with some other measure of first morning urine concentration, it may be urine specific gravity, urine osmolality, and or urine color, which offers a simple assessment and allows ample sensitivity for detecting meaningful deviations in the fluid balance. Urine is a solution of water and with various other substances. Urine analysis is frequently used clinical measure to distinguish between the normal and pathological conditions. Urinary markers for dehydration include urine volume, urine specific gravity, urine osmolality, and urine color. Thus, its concentration varies inversely with volume, which is reduced with dehydration. Urine output generally approximates to 1 to 2 liters per day, but can be increased by order of magnitude when consuming large volumes of fluid. Urine concentration measurements can also be confounded by diet, which may explain large cross-cultural differences in urine osmolality. Here are some tips to drink more water. Try to drink at least 2 to 3 liters of water on sedentary days. Have the habit of drinking fresh water as soon as you woke up from the bed. Drink water before and after each meal. Always carry a bottle of water whenever going outside. During exercise, hydrate at the interval of 10 to 15 minutes. Always note down the urine color. If it is dark in color, it indicates the body is dehydrated. Always prefer plain water instead of fruit juices, bottled drinks and other carbonated beverages. To conclude, water and its consumption, it is a subject which is taken very lightly by us, but its right consumption and the management gives us multiple health benefits, and it helps us to fight innumerable number of diseases. Hence, water should not be neglected and shall be given due importance. Bye for now. We'll meet in the next module. Thank you.